We've been talking up to this point about the healthcare system in the US, in California, in Orange County. We're thinking about all the foibles, all the problems that we have. And I'd like to switch gears to think about a different context where the healthcare system is markedly different. It is my honor to introduce Professor Nai-Wen Q, Dean of the College of Management in the School of Healthcare Administration at Taipei Medical University. He has committed his career to public health, earning a bachelor's degree in public health from National Taiwan University, an MPH from Yale, and a PhD in healthcare policy and management from Johns Hopkins University. Today, he's going to be speaking about the use of AI in healthcare delivery and offering insights from his experiences at TMU. Please welcome Dean Kuo.
Thank you very much. As a closing speaker, my responsibility is simple: to discharge you safely, timely, with clear instruction, but most importantly, no readmission. Okay, thank you for having me here. Today I will tell you the healthcare system in Taiwan and the challenges we're facing, and also some perspectives. Okay. Let's start to have overview Taiwanese healthcare system. Have someone of you have been to Taiwan? Okay, some of you have been to Taiwan. Taiwan is an island approximately the size of Maryland. Half of the size of population of California. So we are a small country, but famous with the semiconductors. Okay, we also have a very famous national health insurance system. It's a state-run, single payer, but it's a social insurance. I often joking that although we are a capitalism, an open market, however, we have two industries which are communalism. One is healthcare, the other one is higher education. Okay, because these two industries are highly regulated in Taiwan. Our national health insurance launched in 1995, so 30 years old already. It's universal coverage, single payer, and very cost effective, but I will tell you why. It's low co-payment, cover dental, and also prescription, and no waiting list, no referral needed. So in our system, we categorize the hospital in 3 different levels. The lowest level is a community hospital. We call it district hospital, and then regional hospital, and then medical centers. Currently, we have around 410 hospitals in Taiwan. And this is a co-payment scheme. You can see it's very affordable. Even you go to the medical center directly, you may only pay US $15 for co-payment. Okay, if a patient is referred by lower level, maybe regional hospital or district hospital, the patient only need to pay around $6 US. So it is very affordable. And we have co-payment for inpatient care. If a patient stay in hospital longer, he or she need to pay higher percentage. But no worries, we have a ceiling. The co-payment ceiling in 2025 is around US 1,600 per admission. But we have an annual ceiling is around 2,600. So it is really a very affordable healthcare. And so this is a ranking by Lambio. According to ranking by Lambio for several years, Taiwan always is on the first place. And also by the Economist magazine in United Kingdom recently, it's ranked second place. This is the Fox paper it compares some data between US and Taiwan. For some premature deaths from some major diseases, Taiwan always better than the United States. Okay, sorry for that. Okay, based on above numbers, it looks like Taiwan is a haven for healthcare. Yes, it is. Taiwan is a haven for people seek for healthcare, but not for providers. I can give you some examples. So the challenges facing the Taiwanese hospital, I think there are three major points. One is comparatively lower reimbursement from the national health insurance. The second is a highly competitive healthcare environment and market, and also increasing demanding from the consumer or patients. How low the Taiwan national health insurance reimbursement rate is? Please see some examples. This is some procedures, reimbursed scheme of the national Taiwan national health insurance. You can see the ECMO, the extracorporeal membrane oxygenation. The reimbursement rate is 10,000 point. Be aware, this is point, not dollars. Because it will be discounted based on the global budget. Okay, so you can see the very common disease, the community-acquired pneumonia. It's a DRG payment in Taiwan. The payment scheme is payment rate is 9,000 point. As I just mentioned, 1 point is not equal to $1. I can use the US dollars as an example. Current exchange rate in 2026 is around $1 US is around 32 new Taiwan dollars. The discount rate is subject the volume of claims, the amount of the global budget preset in each year. Normally, the discounted rate is around 90%. Okay, so for example, for outpatient visit, the Taiwan National Health Insurance only pays around US $10 to $18. That's after discount. And I can use some procedure to compare the difference between the rate of the United States and the Taiwan NHI. US Medicare pay ECMO under DRG 300, DRG 003. That's between US 100,000 and US 300,000. But Taiwan National Health Insurance only pay ECMO, the 9,000 point. After discount is around US 282 per day for an average of 4.25 days. So the Taiwan National Health Insurance only pay the ECMO around 10,000. Only 1,000, but you can see how large is the difference between the US payment and the Taiwanese payment. And another example is community-acquired pneumonia. US Medicare pays the CAP under DRG 193 to 195. It's around US 4,000 to 8,000. Okay. But the Taiwan NHI only pays CAP under Taiwan DRG, TWDRG 111. That's around US 289. So you can see the very large amount of difference between the payment of the United States and the Taiwan. So due to the low reimbursement rates, the profit margin of Taiwanese hospital is pretty low. That's around 2% to 5%, or even negative. So we always joke, the most profitable unit within the hospital is a parking garage in the food court. It's not a joke, it's real. Okay. Okay. I will show you how competitive is for the healthcare market in Taiwan. In 1995, we have around 800 hospitals within 64,000 beds. But you can see the number of hospitals decreasing year by year. However, the total acute beds increasing year by year. Currently, we have only around 400 hospitals. That means around half of the hospital closed. And we have, right now, we have more than 75,000 acute beds. So behind the scenes, many small community hospitals closed because they don't have the economy of scale. Hospital without economy of scale it's very difficult to survive under the low NHI reimbursement and the many cost containment policy adopted by the NHI. We adopt every country's policy, including DRG from the United States and the global budget from Canada. To survive, hospital must enhance their operating efficiency and maintain good quality to attract patients because it is a biased market. Okay. The increasing demanding from customer and patient, is because the increasing gross national income and the educational levels of the customer. So healthcare is a biased market in Taiwan right now. So we also have some achievement of the Taiwanese hospital, excellent efficiency and the quality of care. The strategy of the Taiwanese hospital for the challenge, is to promoting quality of care. The good performance on healthcare quality is from the concept of patient-centered care. I think many of you are aware of that. That's through our hospital accreditation system. Our hospital accreditation system is also learned from the United States. We have a joint commission in Taiwan. You have a joint commission. It's very similar. Okay. And also, we try to increase our operating efficiency by application of IT technologies. I will tell you some examples later. Okay. Why quality matter? Because quality can, decrease the cost. I think many of you knows of that. And also, it's very important for the concept of patient-centered care. Okay. So many Taiwanese hospitals either construct new building or renovate the old building. I can give you some examples. Okay. This is one hospital built, established in 2006 in Middle Taiwan. This is a fancy hospital designed by NBBJ. It's a U.S. architectural firm based on the concept of a healthcare mall. The owner, Dr. Huang, is my very good friend, so I know this hospital very well. You can see it's just like a hotel, lobby, and that's the food court, most profitable area in hospital. This is another picture of food court, and this is the registration area. Okay, there is even an art gallery within the hospital, and also a museum of human body and medicine. Okay, originally they even want to establish a movie theater within, but they couldn't get a license because the Bureau of Health, the local Bureau of Health, afraid, that those communal infection. But we all think it is, very ridiculous because the local health, Bureau of Health approved the full court, but but didn't approve the movie theater. Okay, and this is their VIP suite. Okay, in the United States, private patient room is typical. However, in Taiwan, the Taiwan NHI only cover a triple room. If the patient want to stay in a semi-private or a private patient room, they will have to pay extra out of their own pocket. So this is one major resources of income of a Taiwanese hospital. So we used to call a private patient room a VIP room. I can show you. I think this is very common in the United States. This is VIP patient ward in our hospital, TMU hospital. It's a private patient room. So can you guess how much it is for one day? No, only $375. So you can, thank you so much. So you can see it's very affordable. And let's look at another newly renovated patient ward in our another hospital, which is covered by NHI. It's not so luxury, but it looks good. Okay, this is the elderly ward. It's covered by the National Health Insurance. Okay. So the key point for us to sustain a good quality of care is to the accreditation, as I just mentioned. Our system follow the U.S. the Joint Commission. So we are the first country in the world implement the hospital accreditation, following by United States, Canada, and Australia. And this is the main criteria. I will skip it. Okay. Other examples to enhance the efficiency through application of IT technology, including we use right now almost every Taiwanese hospital we use the auto check-in system to save manpower, and the kiosk for the drug information, and the auto cashier, and the smartphone app for hospital appointment and the information. And also the National Health Insurance established a pharma cloud system. So the physician can use every Taiwanese citizen. We have the NHI smart card. So the physician can check our the outpatient history from our NHI card. So they can check the NHI Pharma Cloud system to avoid duplicate prescription, because we don't have any referral required. So some patients they will go hospital for shopping. Maybe they change hospital or clinics for the same symptom. So the physician they have to check the NHI pharma system, pharma cloud system, to avoid duplicate prescription. And also, The NHI has a EMR and image exchange system to reduce the duplication of some expensive image check, such as CT or MRI. So if a patient, if the physician didn't check the system and has duplicate order for CT or MRI, the second hospital won't get any reimbursement from the NHI. So for this system, I think we save a lot of money for our insurance. So with the application of IT technologies, I think we are toward the so-called paperless and the smart hospital. This is the auto check-in system, and on the left, on the right is the electronic post for OPD service progress. Because not like the United States, our outpatient is very crowded. So maybe there may be more than 50 or 100 patients per clinic. So once a patient has checked in, she can go to the food court or go to anywhere. Then he can check if his number or her number is coming, and then come back to the clinic. This is classic for the drug information and the auto cashier to save some of the manpower. And I think almost every Taiwanese big hospital has their own smartphone app for the information for the registration or appointment. This is a pharma cloud system, online information for recent medication. That's the purpose is to avoid duplication and to avoid waste. And also the electronic medical record image, also images exchange system, I think almost established. So that also can save a lot of money. Like the NHI medical system, you can see almost everyone is on the system. Okay, so even our hospital, our healthcare system facing some challenges, but we also have some perspective in the future. That's with our affordable cost, I think we can develop our international health service in the future. Okay, we have some advantages: affordable cost, world-class quality, and also state-of-the-art device and equipment. These are some some strengths for our clinical skills. And you can compare the cost of Taiwan and the United States. This is not this is not the reimbursement rate for NHI. It's the charge for the foreign patients, but even much lower than the cost of the United States. So we have the highest liver transplantation survival rate in the world, and also the highest successful rate of IVF. And a success rate of 99% in coronary angioplasty and the staining procedure. And we have the first craniofacial center in Southeast Asia with a success rate of 100%. In terms of the various state-of-the-art equipment, using proton therapy as an example, there are only around 40 proton therapy centers in the United States, while Taiwan has 9. This is, in TMU, we have a proton therapy center underground, because we are in the prime area of Taipei, very close to Taipei 101. We don't have a very big campus. So the only solution is we build in the proton therapy center underground if you have chance to visit Taipei, I would be very, glad to provide you a visit to this center. You can see Dean Williamson has visited this center in 2022. Okay. And also, the development of the smart hospital in Taiwan for the AI application, because we have a very successful ICT industry. TSMC, the Taiwan Semiconductor and Manufacturer Company Corporation, and combined with advanced medical technology and the talented medical professional and the talented engineers. So we try to develop a smart hospital. And the key drivers for the healthcare artificial intelligence, including solve some key problems. The most important is to reduce the workload, the time, save time and the cost, and reduce mistake error, improve the service quality and the patient safety, and providing virtual assistance to a patient and the providers, and improving accuracy of diagnosis with imaging and the procedures. And the following content is provided by Professor Peter Zhang. He couldn't come here because right now it's a Lunar New Year holiday in Taiwan. So I asked him to provide me some materials because I am not an expert in AI. So he's an expert and also the director of the program of data science under our college. I will use two examples to show you for the lung cancer diagnosis and the treatment. Okay, and please play the video.
Taipei Medical University employs generative deep learning for the prediction of late-stage lung cancer drug efficacy and prognosis, along with the screening of global clinical trials. Among the top cancers in Taiwan, lung cancer is the leading cause of death, with 70% of patients already in the terminal stage when diagnosed. But thanks to breakthrough AI technology, medical decisions can be made in just 5 seconds based on pathology reports. These decisions include drug selection and new lung cancer clinical trial screening that aim to improve survival rates. The interdisciplinary research team at Taipei Medical University are pioneers in NLP and generative AI technology. We employ multimodal prediction methods in order to provide optimal drug combinations and relevant clinical trials in only 5 seconds. By doing so, this reduces the treatment waiting time and can bring major breakthroughs for late-stage lung cancer treatment. We use state-of-the-art NLP models like BERT and generative GPT technologies that are trained on over 20,000 lung cancer pathology reports. Our developed model can quickly extract up to 52 important features and achieve an F1 score performance of nearly 90% in a 4,000 data point cross-validation. This leads current international benchmarks. These extracted features serve as GPT prompts to generate high-quality summaries. The summaries make crucial information easy to understand while ensuring the safety and privacy of sensitive medical data. This forward-looking technology is awaiting US and Taiwan patents. Moreover, our method further links treatment efficacy to survival data from over 5,000 lung cancer patients and uses generative GPT technology to generate the most effective drug treatment options for the best prognosis. This result is like consulting dozens of experts who have read thousands of pathology reports. The method streamlines shared decision-making between doctors and patients. For late-stage lung cancer patients, it will also create the option of using new drugs in clinical trials. Our NLP model can automatically and accurately match global trials for new drugs. Put more simply, once the pathology reports are out, our BERT GPT algorithm not only offers prognosis and medication options, but also matches relevant global clinical trials, which will enable rapid shared decision-making and expanding treatment possibilities. This product is currently undergoing clinical trial with National Taiwan University Hospital. In addition to awaiting approval for 4 patents from both the United States and Taiwan, the technology will be commercialized through the company DeepRad AI in order to speed up its market application and reach. Taipei Medical University is collaborating with the National Science Council to use the latest in generative AI and NLP technologies, along with big data in healthcare, to achieve more personalized and precise treatment for late-stage lung cancer patients.
Okay, this is the first example using artificial intelligence to help to diagnose early diagnosis for lung cancer and to match for the treatment protocols. And
Taipei Medical University employs.
Okay, and then the second one is the application in emergency department. All you have know that in every country, I think the emergency department is also very crowded, and we need to enhance the efficiency for the operation of the ER. So that's the idea for the application of artificial intelligence in the emergency department to help the physician for increase the diagnosis or treatment efficiency. Okay, please show the video.
Taipei Medical University is working with the Shuangho Hospital emergency team to use generative AI to build an intelligent emergency care support system called AIDE. This AI system will boost emergency care efficiency. Emergency overcrowding has become an increasing global medical crisis. Worldwide emergency departments are facing the dual challenge of staff shortages and increasing numbers of patients. More than 60% of emergency departments are overcrowded. In the United States, 43% of people have utilized emergency services. And in Taiwan, 1 out of every 2 people has visited an emergency department. In Canada, more than 25% of patients had waited over 4 hours in the emergency department. Patients who wait too long in the emergency department face an increasing risk of death. Also, medical staff are resigning in large numbers due to excessive overtime work. The global shortage of emergency doctors has reached 30%. In Taiwan, the shortage of medical staff has reached up to 45%. By 2030, the worldwide shortage of medical staff is expected to exceed 2.5 million. Emergency overcrowding not only prolongs patient waiting time, but also drives up medical costs. Facing severe staffing shortages, existing ER systems struggle to identify potentially critical patients and to allocate limited medical resources efficiently. This leads to soaring healthcare spending. A cross-disciplinary team at Taipei Medical University has integrated large language models with generative AI to develop an intelligent emergency care support system called AIDE, which is trained on nearly 300,000 real medical records. And within minutes of a patient's arrival, AIDE can instantly capture vital signs and chief complaints, predict clinical risks and resource needs accordingly, assist doctors in prioritizing high-risk cases, and start the admission process earlier. AIDE can greatly improve resource utilization. Equipped with explainable AI, AIDE provides doctors with more information and reduce the burden of paperwork, effectively addresses the issues of efficiency and staffing shortages in emergency departments, and bring breakthroughs in decision-making and resource allocation. Our CNTR technology, integrated with large language models, is specially designed for emergency care data to enhance the model's ability to comprehend complex text significantly. And through special mechanisms, it can help overcome the challenge of recognizing rare, high-risk cases. It is also suitable for healthcare institutions in multilingual societies. Backed by patents in both the United States and Taiwan, AIDE has been trained on nearly 200,000 clinical records, and in cross-validation tests, AIDE has achieved an overall accuracy of nearly 90%. It has also been successfully validated at Shinkong Hospital. Using AIDE for decision support can reduce waiting time by as much as 76 minutes, lower hospital costs by up to $6.22 million USD per hospital, and cut CT scans by 50% annually, saving a total of $6.3 billion USD in expenses. This showcases AIDE's strong commercial potential. In collaboration with the National Science Council, Taipei Medical University utilizes the latest generative AI and NLP technologies to create an emergency care-specific intelligence support system to turn the vision of smart healthcare into reality. Taipei Medical University.
Okay. In terms of AI application on hospital operation, we also use the generative AI to help the nurses to finish their progress note. You know, in Taiwan and many countries, we all facing the nursing shortage problems. So we try to reduce the workload of the nurses as much as we can. So we have tried to use, you know, the generative AI. The nurses is just one button, and then our hospital information system will generate the nursing progress note for the nurses to review to reduce their working load. Okay, this is some of the examples. Okay, the experience of Taiwanese hospital demonstrate that even under very low reimbursement rate, hospital can survive well with appropriate strategy of development, also excellent quality of care and good management skills, and with the assistance of IT technologies. Some implication for California and United States. I think both of us, we all have many smart brains. So I think we can improve efficiency through AI application, as many experts have mentioned about the AI application on healthcare. And also, I think maybe in California, maybe you can establish an EMR or cloud system across hospitals to exchange patients' information and reduce duplication. I know in United States, many states are trying to establish a single-payer system. But single-payer system may be too difficult. However, maybe you can unify the reimbursement payment scheme across health plans or insurance companies. I think that can, reduce many administrative costs and inefficiency. And thank you very much for your attention. And this is, Dean Williamson visiting our university in 2022. You can see the very beautiful Taipei 101 is very close to our university. And welcome to Taipei. Thank you very much.
Thank you. That was very interesting. I would love to ask you a million questions, but I have access to you more than they do. So perhaps we can get some questions from the audience.
First, thank you so much for the presentation. I found the pictures from the Taiwanese hospitals very insightful. I have two questions. You were listing on your slides prices in American dollars. And I'm wondering if you adjust these prices to the local cost of living, how would these prices compare to the American prices? For example, like obviously in Orange County, we, $375 per diem for inpatient is very cheap, but would that be, how is this expensive for the local population? And my second question is that you mentioned on one of your slides that the patient enjoy these reimbursements, but not the providers. And nevertheless, you showed us pictures of fantastic infrastructure. So can you please elaborate what do you mean by that? Do you mean that the hospitals are running deficits? Do you mean that that the providers are not paid high salaries? How does a hospital with such low reimbursement rates afford such infrastructure, and are the providers compensated for their services? Thank you.
Okay, for the first question, in terms of I think the living expenses or the income level, I think in Taiwan right now, the average income per person is, I think, maybe around 35,000 US dollars. So that's approximately 2/3 of the United States. So I think compared with the United States, the patient, the payment from patient is pretty low. Okay, so it's very affordable for every people in Taiwan. Even a foreigner, if he or she go to Taiwan for study, for working, if you enter Taiwan for 6 months, you can also enjoy the national health insurance of Taiwan. Okay, and the second question. Some payment of the salary of the Taiwanese providers, especially the nurses, I think is pretty low compared to the United States. Okay, and for physicians, that depends on the specialties. For surgeon, I think it is relatively high, but for the primary care physicians or internal physician, I think that may be relatively low compared to the United States. Yeah.
Oh, there's one over here.
Hi, I saw on one of your slides for payment schedule, 150 visits per day. How many doctors are seeing? Who sees 150 patients a day?
For some very, very famous physician, they may have more than 100 or 150 patient visits per clinic. So I know some physicians, they are very famous. Their clinic begin from maybe 1:30 p.m. They will end their clinic at maybe 10 p.m. or 11 p.m. So, that's one of the problems. I know in the United States, the outpatient visit, the time is pretty longer than the outpatient visit in Taiwan. In Taiwan, maybe average, maybe physician, that's also different by specialty, but average, the physicians see a patient, I think maybe within 5 to 10 minutes. But in the United States, I think maybe a physician can see a patient for as long as maybe 30 minutes. So that's quite a big difference.
We have another one right here. Hello. A lot of the cool new things coming up were dependent on computing power, cloud infrastructure, security, and so I wanted to know what are the concerns and what are things that Taiwan is doing to address that component of the innovation.
Okay. I think in terms of the information system, cybersecurity is very important. I think the cybersecurity for our national health insurance is the standard is pretty high. But for hospitals, I think our standard is getting higher and higher because in the past few years, some of our big hospital has been blackmailed by the hackers. So right now, I think we have evaluated our cybersecurity standard to make sure our system is in a very safe environment. Yeah.
Thank you. Honestly, I don't know you'll be here. Actually, I live here. I will go to Taiwan to your hospital to get treatment because things just can't get fixed. But what really amazed me was, I think it would be great to share is, I will go to see one of your doctors at an MRI in your first floor, and in less than 20 minutes, the MRI is with the doctor, and I get fixed right away. So I think this is where probably just talking about difference here. I probably have to go to many doctor visit, have to get a referral. Just you can't get things done. And a lot of problem I can't resolve here is done in Taiwan in one visit. So that's really amazing. That's why I travel all the way to Taiwan. Just kind of want to know, if you don't mind, is you talk about the cloud, for pharma, and also sharing with the hospitals, how you make that happen, because it seems like there's a lot of silo here, but be able to kind of share the records, and that can create efficiency and just better outcome. How did that come about? It's just like, is there any pathway that we can learn from what you have done in Taiwan?
Okay, I think that, thank you very much for your compliment, but I think, that's because in Taiwan, we don't need, as you say, we don't need referral. And so our national health insurance must have some measure to prevent duplication. So that's why our national health insurance established the pharma cloud and also the hospital image cloud. Since we are under a single payer system, so the NHI, the National Health Insurance Administration, is the only provider. Okay, so any major established by our NHI encounter almost no barrier. So every hospital will abide by the rule established by the NHI. Otherwise, you can withdraw. You don't have to contract with the NHI. But if a hospital, did so, the hospital will lose all of its patients. So that's why our national health insurance has the power. Yeah.
Thank you.
Thank you very much.
So waiting for us is the reception, and I do encourage you to go and remember to talk to your 1 or 5 friends. Diana Ramos kind of upped that stake. But I want to say a few things. You will be getting 2 different surveys. One is for CME purposes, and the other is to help us with planning next year. Please fill them out, because we really do want your feedback so that we can make this even better next year. I want to remind the students of the upcoming case competition, which launches on April 20th. And I want you to remember that all of the slides that you saw here that are shareable are on the app. So those are some reminders and some housekeeping. Remember, the bar is free for you. And then I want to make some thank yous. So thank you to Christoph Stremicus, which I keep stumbling on his name sometimes, and Marie Ross for your thought leadership in developing this agenda today. So I really thank you so much. I think we had a great day. Thank you so much for the sponsors for funding this event so that we could bring this to you, especially California Healthcare Foundation. I want to thank all of the presenters today. They delivered intriguing content that started conversations that I hope will continue even after we leave here. I would be remiss not to thank Diane and Ella and Christina again for all of the stuff that happens on the backside and makes this come to life. And most of all, I really want to thank all of you that attended. This event couldn't be possible without you, your interest in this industry, sharing your expertise, and making a community. So thank you so much for all of your efforts today. And now you are released. Thank you.